Okay, we can get started. Hello, everyone. My name is Shaylin Cullen, and I am the technical manager for this session titled How Does Your Meal Measure Up? Setting Nutrition Guidelines and Assessing the Nutritional Quality of Institutional Meal Programs, chaired by Winnie Bell, Melissa Vargas, and Payman Malati. Thank you for taking part in ANH 2026, and we look forward to a robust and interactive session today. A quick reminder that everything you might need to access the conference materials and program can be found on the ANH Academy website. Before Winnie takes the conversation forward, I have a few technical announcements to ensure our experience is as smooth and interactive as possible. First, this session will be recorded and posted on the ANH Academy website before the end of the conference. Second, all participants have been muted upon entry, but please introduce yourselves using the chat feature. Let us know your name, where you are joining us from, and the organization that you work with. We encourage you to share your webcam video feed during the session if your connection allows it. And if you have any questions, we invite you to share them in the chat throughout the session. And lastly, if at any point you experience technical issues, please check your audio settings and your internet connection. You can always try to reconnect to the session using the same Zoom link. And if you have a technical question, please send me a private message using the chat feature. And thanks so much. Over to you, Winnie.
Great. Thank you very much for the introduction, Shaylin. I'm going to go ahead and share my screen, and then we will take it from there. Just one moment. Okay. Wonderful. So welcome everyone to this learning lab. As Shaylin said, we are going to be focusing on setting nutrition guidelines and standards, as well as measuring the nutritional quality of institutional meals in school settings, as well as other potential contexts. So the plan for the next 2 hours is mapped out on this slide. I'm going to introduce the three of us facilitators, and then we're going to do a brief icebreaker exercise. Payman is going to talk about school meal programs in general and the sort of current context and investment case for them. We're then going to hear from Melissa, who will be talking about the nutritional quality of school meals and the importance of setting nutrition standards and guidelines. I'll then come back and talk about the GDQS, or the Global Diet Quality Score, meal and menu metrics, as well as provide a demo of our app. And then we're going to end with basically some discussion and key takeaways. Throughout the next 2 hours, we'll have opportunities for discussion and question and answers. If you have burning questions in the meantime, before we get to the live questions, feel free to put them in the chat, and we'll keep track of those and can come back and address them during the open discussion. So the learning objectives for today are really to, hopefully when you all walk away from this experience in a couple of hours, to be able to articulate the importance of institutional meal programs, and particularly school meal programs, and how these can be a leverage point for food system change. To also explain why and have a better understanding of why setting nutrition standards and guidelines and measuring the nutritional quality of school meals is important in reaching the nutritional objectives of school meal programs. And then also to establish an understanding about the Global Diet Quality Score, meal and menu metrics, how they're used, when they can be used, and also how the app can help you collect, tabulate, and interpret data. So as you know, we will be your three facilitators for today. I'm Winnie Bell. I'm a technical advisor at Intake Center for Dietary Assessment. I'm joined by Payman Malani, who is a director of the Food Initiative at the Rockefeller Foundation, and also Melissa Vargas, who's here with me in the room, fortunately, who's a nutrition officer at the Food and Agriculture Organization of the United Nations. So before we dive into the presentations, we wanted to take an opportunity to get to know all of you a little bit better and see who's in the room with us. So I'm going to switch screens as smoothly as possible and go ahead and share this other option with you. One moment while I get set up here. Let me activate this. So if you are able to, please either scan the QR code in the upper right-hand corner with your phone, or use the link that's in the left-hand corner, which I think Shaylin is also putting into the chat, to arrive at this page and then click on the map and let us know where you currently are. So I'm seeing a couple pins show up here. Great. Some folks are in Europe. I think there are more than 3 people in the room, so, just wait a minute. Excellent. Oh, somebody in Nigeria. Great. Ethiopia. Excellent. Welcome, everyone. I don't know, Melissa, if you're visible in the screen. Okay. Great. Okay, so we have a global spread, bit of a global spread. Some in Asia, Eastern Africa, West Africa, a little bit in Europe, Mexico, looks like the US. Welcome, everyone. Okay, so feel free to keep, adding pins as we go. I don't think we still don't have everyone yet, but I'm going to move on for the sake of time. So our next question for you, again, in an effort to understand a little bit more about our audience for today. Let me go to the next question. Okay, so now we would appreciate it if you could share with us what is your sort of core topic area of focus, or if you're still studying, which topics you're specifically interested in. If you enter more than one word, to ensure that they stay together, it's important to use an underscore between the 2 words. So, for example, nutrition and health, you would put an underscore between those words. Again, this is just to know what topics you're already attuned to. It's great to know that there are some folks in this room who work on school meals. I think I saw some of you enter the room. So we have food security, diet quality, school meals. Great, happy to know. Okay, the food environment, gender and girls, aquaculture and sustainable development policies, excellent. It's great to see that, the food environment just got real big. So I guess there are a number of people working on that topic. Very relevant also to school meals and the school food environment in general. It's great to see so many people who are interested in or already working on the topic of school meals. I hope we can provide new and interesting information for you today. Great. Okay, so a lot of expertise in this room on food, nutrition, diet quality, the food environment, and school meals. So welcome, everyone. And then final question before we get into the lecture or the presentation is to ask you, what words come to mind when you think about school meals? This could be based on your memory of being a child and eating food at schools, or it could be based on your sort of association now as a professional, what school meals means for you. So delicious, great. That sounds like whoever wrote that had a positive and lasting experience of school meals. Picky eaters, fair enough. Palatability, extremely important. Unexplored, yes, I agree, kind of untapped area of importance. Inadequate. Equity, yeah, that's always a concern and something to be aware of. Finger foods. I look forward to hearing more details on that association at some point, hopefully. Children thriving, that's a very positive association of school meals done well. Poor quality. Great. Okay, so lots of examples. I will say, since I'm not typing in my response here, when I made this question, I added French fries because my memory of school meals was these very bright orange French fries. Um, okay, bland, child-centered. Great. So I think this array of words really, I think nicely highlights a sort of spectrum of experiences and associations with school meals. There are some very positive and nice memories or associations, right? Delicious, a variety, dessert even, that could be a positive thing. But then there are also things that are more on the, let's say, negative or not fully realized side of the spectrum in terms of there being, potentially poor quality or inadequacy issues. So thank you all for sharing those reflections and thoughts. So I'm going to move us back to the slide deck now. And I'm going to hand the microphone over to our colleague Damon to talk for the next several minutes.
Thanks, Winnie, and great to be with everyone here in this session. So I'm going to just talk a little bit about the investment case for school meal programs and why do they matter. Um, One thing that I can just mention from our own experience at the Rockefeller Foundation in terms of our investments in food and the food system is that we eventually, over the past few years, came to realize that actually the best entry point that we ourselves could identify towards food systems change were school meal programs. Uh, Not that other things cannot be effective or aren't important. It's just that rarely do you see this element of integration that school meal programs can bring to food systems interventions. I mean, by definition, they have the potential to marry demand and supply. And we know of so many agriculture food systems initiatives that don't go far because they focus too much on one side of the equation, more often than not on the supply side. Oh, what do we do to equip the farmers, provide subsidies, do this and that? But okay, where is the demand if we want to go beyond just increasing the supply? Next, please. So that's why we came up with this analogy of school meals as being the smartphone of development. For some reason, we need the title is not showing up here, but the title of this slide is that school meals are the smartphone of development. And what do we mean by that? Is that if we think of the smartphone, which we all own and love, they actually integrate multiple functionalities into one device, right? I mean, they're a communication device, an internet, camera, productivity tools, navigation services, geolocation, all of that. If you take any one of those functionalities in isolation, there are equally good or even better devices out there. There are better cameras, there are better phones, there are better navigation tools, etc. The magic of the smartphone is the integration because it reflects the integrated nature of the lives we all live. School meal programs have similar benefits when you think of vulnerable communities. So they actually have impacts across all these dimensions highlighted here. But the beauty of it is that they do it in an integrated way. So, for example, educational outcomes, there's evidence that they improve enrollment, attendance, and even in some studies, reading scores of children. There's an element of community empowerment because they can actually improve the female social capital in a community. That's been seen in different parts. Gender equity as well. They disproportionately benefit girls because typically when school meals are first made available, there is, let's say, you see more girls joining proportionally the school program, attend the school than even boys. Child health, there is evidence of significant reductions in anemia, especially when you have nutritious meals and fortification in it. Nutrition security, so particularly in vulnerable areas, school meals can reduce food insecurity among a very vulnerable population. We're talking about children attending public schools. We know that wealthy kids rarely attend public schools. but also they have a potential impact on overall nutrition status via an improved diet. We know that in many contexts, the school meal is let's say, the best meal and often the only meal that children receive during the day. So the nutritional composition of that meal matters a lot to diet quality and ultimately nutrition status. Local economic development. I mean, there is a range of returns that have been documented here, ranging from 5 times to even 35 times return on investment. Of course, a lot of that hinges on implementation. But even when it's a basic implementation, you already see a 5 times ROI in the investment. And then climate resilience, especially if you can do what's called homegrown school feeding, where you really prioritize the local sourcing of the foods that make into the menu with preference for smallholder farmers, diversified menus that in turn can lead to diversified crops. So from plot to plate, you have that potential for integration. Next. Now there's growing global momentum for school meals, but there are challenges and a lot of areas where we need to improve as a global community on school meals, including monitoring and evaluation. On the positive side of things, today we have about 466 million children already receiving a daily school meal. That's up 80 million or 20% since 2020. So we're talking about post-COVID years. And that's remarkable. If anything, COVID was a bit of a catalyzer in terms of people realizing of, how valuable these things are because of the counterfactual it created that all these kids who were receiving a meal now weren't getting one. And a lot of, let's say, negative consequences were noticed from that. So the School Meals Coalition, I think, is really the entity that materializes or represents this global momentum. It emerged from the Food System Summit of 2021, really as by far the strongest coalition out there. And right now, it already brings together 109 member governments. That's 2/3 of the global population, 147 partners from all different sectors, co-chaired currently by Brazil, Finland, and France. And the annual funding has doubled over the past 4 or 5 years. And another beauty of school meal programs, most of them domestically financed. That's one of the critical challenges in the world of development, right? Where so many interventions depend on external help. Here, even in low-income countries, you see a strong effort by governments to advance towards self-sustainability of these programs. And the goal and shared vision of the School Meals Coalition is for every child to receive a healthy, sustainably sourced daily meal by 2030. The School Meals Coalition has several initiatives already up and running. I just wanted to highlight the School Meals Accelerator, which is perhaps the most recent of them, which was launched earlier this year with the intent to accelerate this global uptake of school meals. So the ambition of the School Meals Accelerator is to help countries committed to expanding and improving their school meal programs to reach an additional 100 million children with healthy and sustainably sourced meals by 2030. So there's a lot of activity and momentum in that. Now, on the challenge side of things, these are things that pretty much every school meal programs at the national level or subnational level has to grapple with, right? Sustainable financing is a very critical one. I mean, everything else really depends on this. That's why even within the orbit of the School Meals Coalition, we have the Sustainable Financing Initiative, which is helping countries figure out how to expand the fiscal space to things like health taxes and other measures to be able to expand the reach of the school meals and make them more nutritious. Cross-sectoral coordination is a challenge that's unique to any food systems intervention, having the different ministries and agencies talk to each other, collaborate, and integrate policy. So that's something that I think is an area of continuous improvement for countries. Program design and delivery are, of course, the heart of it. There too, one of the beauties of the School Meals Coalition is to promote this sharing at the regional and global level of learnings, best practices, and how we can sort of learn from each other how to do this better and better. And then last but not least, monitoring and evaluation. This is, of course, critical in any effort. I think in school meals, it is particularly important because there is a vast difference between a country just declaring that they are reaching X million kids and looking at, okay, how many days of the calendar, the academic calendar, are those kids really receiving a meals, and what is the quality, the nutritional quality of those meals. So that is really the segue for today's presentation on the GDQS meal and menu. It's really, we think, a key enabler to the monitoring and evaluation, which can help both programs, governments in their program implementations, but also further down the road, results-based financing mechanisms where other funders can come to the table, in blended finance structures, having the nutritional and at some point environmental quality of meals be sort of one of the key, if not the key, outcome indicator. Thanks, and let me hand it back to you, Whit.
Excellent. Thank you so much, Payman, for that great overview and introduction to this topic. I think that sets the stage really perfectly for the next couple points of presentation and discussion. I'm going to hand the mic over now to Melissa Vargas, who is going to talk about the nutritional quality of school meals and the importance of setting nutrition standards and guidelines. And so this is sort of the first pillar from which flows the monitoring and evaluation that Payman just had finished off by talking about, right? So we're going to touch on all these key points, but first, over to Melissa.
Thank you. Thank you so much, Payman, and I'm very happy to go after you. And I think you said it very well. School meal programs are an avenue for multi-sectoral gains, and we have to keep always in the horizon the multiple gains and the multiple objectives of these programs. And I think the word that we like to use here in FAO is holistic, because it's even if we're focusing now on the nutritional quality and the nutrition outcomes, we need to consider them in a holistic view. So ensuring that we achieve the nutrition objectives, but with that consideration of additional sustainable development objectives like environmental sustainability, social justice, development of local food systems, and all the others that you mentioned. So now I will start my presentation, and I want to hear a little bit about what you think in this poll, and it's a little bit of devil's advocate, let's say, on what is the impact on nutrition of school meal programs. So I want you to tell me.
What's that? Sorry.
No worries. We are our own IT techs today. Okay, so you should see in your phones or your computers a statement, and I would like you to say if you think it's true or false. And the statement is, school meals always improve children's nutritional status. We will give you a couple of minutes.
Maybe I shouldn't share the screen yet because people are feeding off of each other's responses. I don't know.
It's really nice to see that. The changes of hearts and minds. Okay.
So we know we have 32 people in the room. Okay. 16 people.
Don't be shy. There is.
It also is anonymous, I should have
Yes.
said. So we don't know.
No knowledge check here.
Yeah. And sorry, I should have said that at the beginning too. You don't need to enter your name when you first scan. You can just go in directly, but in any case, it is anonymous. So we're not paying attention to that detail.
Okay, so it's 12 that say false and 5 that say true. And let's go and see what the evidence says.
Okay.
Okay, So this is a question that we liked very much. And indeed, when government representatives state what are the main objectives of their school meal programs, the vast majority report that they have a nutrition objective. So if you see, this is from the Global Child Nutrition Foundation survey that they conduct every 4 or 5 years or so. And you can see that the majority of the programs, I think they evaluated about more than 100, state that they have a nutrition objective. So, sorry. Again, we are our own IT today. And we just wanted to go back to the poll. Indeed, nutrition outcomes are one of the main, let's say, strong points of school meal programs. But actually, what does the evidence say? So the past 10 years have been very fertile for systematic reviews and meta-analysis of school meal programs, of case control studies and randomized controlled trials. And what they have seen is that they do have benefits on nutrition, but in the majority of cases, they are very modest, or there is also mixed results, for instance, on BMI, on several iron indicators. And here I'm talking about the ones that provide the meals without supplementation, because we need to ensure that we look at the school meals, yes, as a platform for multiple interventions, but we need to see what we are measuring. So is it the meal that is being provided and how it is associated or has the relationship with nutrition outcomes at the level of nutritional status? So as you see, the panorama is either some modest gains or mixed effects on specific indicators of nutritional status. In terms of diet outcomes, surprisingly, the systematic reviews focus less on these intermediate outcomes, and they find that there is slight increases in fruit and vegetable intake, no effect on consumption of unhealthy foods. They have mixed effects on energy intake or on prevalence of inadequacy of iron intake. So the panorama is a little bit mixed. And why do we see this? Well, first, I think we need to say that there is a little bit of a black box when we see the evidence. It's many times we see the children received school meals and then they measured nutrition outcomes at the end. But we don't really know what the payment was mentioning. What is the real dose and the duration that they received the meals? Did they receive them every day? Did they receive them on how many days per calendar year? What was the composition of the meals? Were there other interventions that they received with the school meal? What was the baseline indicators of the populations that were targeted? All of this, of course, has an influence on the nutrition outcome. So it's not surprise that the results are mixed. Also, because school meal programs have very different nutrition objectives. Some of them are targeting on their nutrition and food insecurity. Others are targeting more prevention of obesity, how to model healthy meals, and they really are in different contexts. So we want to start unpacking this black box. First, we see that definitely, as Pigman mentioned again, implementation is extremely important. If we design a program, but we have challenges in implementing, of course, we're not going to get the stated outcomes or the desired objectives in this case of nutrition. So we have to focus again on the how many days do children receive the meals and all of these aspects that can affect implementation. We know that there are many challenges of supply, aspects of incoherence in terms of procurement. Maybe what was planned, we couldn't buy it at the school level, so children didn't actually receive it, or different aspects of the program that can be affected by crisis, by financial burdens, by the cost, by the varying cost of ingredients. So all of this definitely can affect implementation. But at the same time, we see in the evidence that what the meal consists of is a very key part of what determines the objectives and the outcomes of these programs. We cannot really compare for instance, a staple-based meal that is provided every day, or a very diversified meal that consists of different food groups, and we cannot compare actually for children that have very low baseline indicators starting from the beginning with children that are mostly normal weight or they are overweight, and those that have very important micronutrient deficiencies and very low intakes. So all of this is important that we really unpack it when we're looking at the evidence. And there are some insights that have come from the evidence that tells us that when school meals are following what we like to call robust nutrition guidelines and standards, with basically it means that they are based on the evidence, they're based on the context, that they're really looking at the targeted children and looking at what are their main diet gaps. These improve diet quality outcomes better than when the programs are following budget restrictions, for instance, and they define their meal planning like this. So we have seen that the programs that follow clear and specific nutrition guidelines standards tend to be more effective than those without. And that is why FAO, UNICEF, the World Health Organization, which recently published their guidelines on school food and nutrition, they all recommend that programs have very strong nutrition guidelines and standards to follow for the planning of their school meals. So here we scratch meal criteria and then we change it for well-designed needs-based nutrition guidelines and standards. And I'm going to talk a little bit more about the needs-based part of it. And then we see that, of course, it's not a linear change, because it's a very simplified theory of change, but we have to pass through diet quality to ensure that we have also changes in the longer nutrition outcomes, which depend on many other aspects apart from diet. So where do we stand? In FAO, a few years ago, we surveyed 33 low and middle income countries to determine where they stand in terms of if their school meal programs have nutrition guidelines and standards, and if so, what are the main challenges that they have. And we found that many countries, even though the evidence is telling us that this is an important criteria of effective school meal programs, do not have official nutrition guidelines and standards. And then at the same time, we found a very big gap, that there is really no clarity on how countries make decisions on what should be their nutrition guidelines and standards. Particularly when they don't have any dietary intake data of what the children and adolescents in their countries eat, what are the differences between regions, who are the most vulnerable, and then the ones that have a clear process, which are the minority, there is a narrow design. For instance, they focus only on specific nutrient requirements or energy requirements or specific food groups, but they don't consider aspects such as that are very important, so that the meals are consumed as intended, parts on taste, on acceptability, on enjoyment, socialization, and all the other aspects that we know are important for ensuring that this school meal is consumed as intended. Then we see that even when nutrition guidelines and standards exist, of course, implementation and acceptability challenges persist. And I'm going to talk a little bit about what we did when we found this important gap. I think Payman mentioned it very well already. Without effective implementation, even if we have perfect nutrition guidelines and standards, then they will not translate into the actual meals that are prepared and served to the children, and they would have limited acceptability. Maybe we will have an erosion in the confidence of this policy instrument, because this is a policy instrument, and then we will not have the return on investment that Payman was talking about. So we will have a missed opportunity in that. And then the school meal programs will not have achieved their potential. So we come back to the famous black box that we have unpacked. And then we see that it's not a linear relationship. There are also aspects that affect implementation in terms of what are the capacities of the system. Maybe the programs, school meal programs in the beginning were designed with a view of food insecurity, and they were designed to not have kitchens and infrastructure, and they were having, for instance, fortified snacks that didn't need preparation. But now we moved and we evolved, and we really want to provide this food-based approach and these meals to children. But now we don't have this infrastructure set in place. Maybe the capacities are lacking. Maybe there are issues with the way that the procurement is set in legislation, that we cannot really procure from smallholders or from farmers that produce all the fresh food that we want to do. And then we need to modify the policy or the legislation on public procurement. Maybe we have issues with supply chains. We want to procure these foods, but simply there is not enough supply. And then definitely one meal or even two meals do not define all the diets of children. Even if it's the only meal, the nutritious meal that they consume, there are other aspects of the home diet that we need to consider. For instance, if parents are substituting or having a negative effect once they know that the children are receiving a very nutritious meal at school, do they then not provide nutritious foods at home, or they maybe prefer to give it to siblings that are not receiving the school meal? Also, how children look at competitive foods, what are their food practices? Even in food insecure context, we have the literature is clear. We have seen it firsthand. They have pocket money. They prefer other foods. Maybe they reject the school meals. Maybe they consume it together. So even the impact on diet quality is not so straightforward. We have to consider all of these aspects, and we have to develop interventions to target these specific aspects that will definitely affect diet quality and even further nutrition outcomes. So am I good on time?
Yeah.
Yes.
Okay.
Okay, now I have a second poll, and I want to ask you if you think that all school meals should provide at least 1/3 of children's energy and nutrient requirements. We can say true, we can say false, we can say not sure. And this is not a straightforward question, so I am very interested in what you have to say.
Yeah. And again, this is anonymous, so feel comfortable
Yes.
expressing what you think.
Okay, so we have a big majority that says true, and then very courageous, not sure, and then a very courageous false. Okay, good. So going back to the presentation, and I have to thank Winnie for her amazing IT skills. I wouldn't be able to do this.
Let's see. The day is not over yet.
Okay, so definitely that was a trick question because I want to define what we mean by nutrition guidelines and standards. We mean as a set of rules, principles, and recommendations that are based on sound nutrition science, on what the evidence says between the relationship of diet and disease, and diet and health, and the national local situation. I was talking about not all school meal programs have the same nutrition objectives. They have been designed for very different purposes from all over the let's say the stream of nutrition needs. But they are designed to improve the nutrition quality, quantity, and adequacy of the foods and meals that are provided in schools. So we have a set of nutrient targets that we combine with a set of food targets, as well as recommendations on how to improve the consumption of the meal. And these nutrition guidelines and standards define what foods and nutrients school meals should provide. Not all of them, but the main critical ones, who the meals are designed for, which means we review the evidence to see which groups should be targeted with considerations for the most vulnerable, and then we make changes if needed, and then how school meals can support broader goals that Payman already mentioned: sustainability, equity, education. All of these aspects are considered in the process of developing nutrition guidelines and standards. And why did we say that what did we say that 1/3 they should provide at minimum 1/3 of the energy and nutrient requirements? Because this has been a global guideline or a global benchmark that has been applied for the past years, and it makes sense. It's definitely it comes from somewhere. It comes from an estimate that maybe that the meal it should be one of the three meals that children usually eat in their day. But many times this maybe blanket recommendation may not be adequate for every school meal program under the lens. Sometimes, for instance, we really need to focus on the food groups. We need to see, I will give you an example. We tested an approach in Cambodia, and we saw that children were not eating fruits. They were eating plenty of vegetables. They had a quite diverse diet. Even in some areas of socioeconomic with low socioeconomic indicators, they were not eating fruits. And fruits were very locally available. They were very varied. They were during the whole year, and they were not eating it. So we considered the school meal as an opportunity to fill a specific dietary gap that they did not fill in their home diets. When we piloted the introduction of fruit and other improvements to the meal, we saw that children were really accepting of the fruit. It's simply that there were parts when we did qualitative research also that they did not have the opportunity to eat them, that they were not sold in schools, that they were, let's say that in the house were a little bit expensive for parents to buy them. So we saw an immediate data gap for the whole diet, and then we had the opportunity of introducing or filling a part of that gap from usual intake to the recommendation for the totality of fruits and vegetables that a child should eat per day. So this is what we are trying to do. We're trying to contextualize the process of how to define what the school meal should provide these children. Maybe in some children's it will be the fruit, in some others it will be the variety of vegetables that they consume, maybe in some others where animal source foods, in some others there are modeling of a healthy diet that they may not, because they may have overconsumption of energy dense, low poor quality food at school. So we need to really see what are the main dietary gaps in the children that we are targeting. And by targeting, I also mean when the programs are universal, to understand what the children in these regions need and require to improve their overall diet quality. And here, that is why we say we do not want to provide global generic guidelines, but we want to make sure that these are adequate to the context. And in a very related question, I promise that this is, I think, my last poll. I want you to tell me if you think that you have food-based dietary guidelines in your country. Because food-based dietary guidelines, as you are putting a pin on your map, they are context specific. They define what a healthy diet means for the population. So when we develop nutrition guidelines and standards, we call on to these national food-based dietary guidelines. We see what are the recommendations for the population that are evidence-based and context-specific, and then we derive what the school meal can support and can feel a part of those. And I see a lot of pins. And definitely for the ones that do not know, if you have food-based dietary guidelines, again, what a healthy diet means for your country, we invite you to go into the FAO food-based dietary guidelines website, where you can see if your country has national dietary guidelines, because this is one of the bases that we use to develop school meal nutrition guidelines and standards for school meals. Okay, we can go back. And I'm mindful of my time. Okay, so as I mentioned before, in FAO, we partner with the World Food Program and with many other partners in terms of the School Meals Coalition umbrella, also here with Winnie and with many other partners. And we develop this methodology or this process to exactly do that, set context-specific nutrition guidelines and standards for school meals that are robust, that follow the evidence, but that are rooted in the context. And I have here in this slide the 7 phases of this methodology. This methodology will be available for the public in about 2 weeks' time in the FAO website, and I will share with you the link. But basically, we have a process that is, let's say, that is idea that is thought of like the food-based dietary guidelines. So we basically generate buy-in for the process and the institutional setup. We review the evidence and assess the situation of the school children and adolescents' diets in the country, as well as their needs in terms of education, as well as if we have other sustainable development objectives that the school meal program is pursuing. And then we also do an assessment of the school food system to determine if these nutrition guidelines standards are feasible, are achievable. Then we define and refine targets in food groups and nutrients, as well as in the broader mealtime experience. We determine the feasibility of these targets. We integrate recommendations for the mealtime experience, and then we define if there are necessary modifications for groups with specific needs, for instance, important food allergies or cultural minorities, religious minorities, or specific groups that are in specific regions of the country. Then we validate them with experts and public consultation, because this is quite important. In my home country, in Costa Rica, we improved the nutrition quality of school meals after a census revealed very high levels of childhood obesity. And when the changes were made to the school meal, they were not received positively by parent and student associations. So it's important that we ensure a participatory approach, that we validate this, that we look at non-intended consequences of potential changes to the school meal composition. For instance, if children are singled out, what it could be the long-term repercussions of these changes, what could be the changes for the food system of some of these improvements for nutrition quality. Then we select the approach we call it translate these nutrition guidelines and standards, this set of targets into menus and recipes. And we can use the different ways to do that. We can do it, let's say, by hand, using software, using linear modeling. There are many pros and cons of each approach. Then we recommend to pilot test the meal so we can see what is the actual cost, the running cost of them, if there are aspects that are still unfeasible, what are the changes required to the system, to the capacity needs. And then we develop a strong implementation, monitoring, and evaluation plan. And again, all of this is, we look for entry points to ensure that these are part of the school meal program implementation, to ensure that what we plan gets implemented and gets measured. And yeah, I will go very fast on the second part of my presentation. In all of this that I presented, where do we fit the measuring of the nutrition quality of the school meals? Well, we ensure that, so when we develop nutrition guidelines and standards, we're ensuring that these meals are nutritionally optimal for the children they target. But we, of course, this is just a document. We need to ensure that it's implemented, and we need to ensure that the children eat it, and we need to make sure that they have the benefits in terms of their whole diet. So how do we do that? Well, in part of it, we measure nutrition quality at different levels, and this allows us to assess that they are being compliant with the nutrition guidelines and standards that we set. It makes us, it supports us to identify areas for improvement. Where are we failing? Why are different schools having low compliance? Is it an issue of supply? Is it an issue of capacity? Are there more children showing up to eat than what was planned for? Are there issues with prices? And then, of course, it ensures accountability for the investments made in terms of the government and also for the children. So it becomes a tool for continuous improvement. Um, the current situation is that there are countries that are assessing serve the nutrition quality of served school meals regularly and objectively, but it's still very rare. And the widespread indicators, as Payman mentioned, in terms of coverage, are not assessing nutrition quality. And now, of course, we will present very exciting indicators for measuring just that. And the research is growing, but the methods are often not globally comparable, and then the tools are not harmonized, and we still have a lot of questions in terms of sampling, in terms of where to do it, in terms of how to compare the results. However, the situation is changing, and I'm very happy that Winnie will present how. And just to finalize here, there are specific levels where we can measure compliance with what we have designed to that is a healthy or nutritionally adequate school meal for the context. When we plan them, let's say the menus and ingredients, if they are aligned with the nutrition guidelines and standards, when they are prepared, and then when they are served. And maybe these last two are similar, but there are specific differences that can affect the way that the nutrition quality is interpreted. Maybe, as I mentioned before, more children showed up during the day than it was planned, or there were other issues that affected the serving, or maybe some children were served more than they needed, or the portion sizes were not fully respected. So there are nuances there that are important to consider. Maybe there are not, cannot measure specifically at every level, but we have to consider these nuances for interpretation. And then just finalizing with what are the main challenges that governments, researchers, advocates have in terms of measuring and interpreting nutrition quality of school meals, the context, and this is something that Winnie will talk about. When the school meal quality measured is reported versus observed, methodological challenges of when the children are served, and how to not interrupt that, and how to not affect how the cooks behave, the resources to do so. Of course, it's important. It needs its own resources, the capacities to do so, and then, as I mentioned, interpreting and using the data adequately for continuous improvement for the program. And I will stop here. I would like to acknowledge our team leader, Fatima Hashem, for her technical lead, and then my colleague Cynthia, who are supporting also this work. And yeah, I have like 5 minutes or less for questions. In case you want to raise your hand or you want to put it in the chat, I'm very happy to hear your questions. Of course, I will also leave you my contact. Okay. Yes, the methodology that I mentioned will be available in the coming weeks, and I will share the link with you. I will also share where we're expected to have that published. Okay. Any other questions? I will be happy to take it now or later if you need some time to think about it. I know that there was a lot of information.
Yeah. That was great, Melissa. Thank you very much. And that was a lot of information. Maybe we'll just give it a second if anybody does want to unmute and ask a question or chat it, put it into the chat. Otherwise, we will have more time towards the end, also for discussion, more open discussion. Okay. So I think we'll take the silence. We hope everybody is still with us and awake. And I don't know, it might be lunchtime where you are, or dinner time.
I think there was
I think a question maybe just came in. So Melissa, do you want to read it? And
yes, are there any efforts to check the influence of after-school diets on school-based meals? Okay, if I understand correctly, you mean the broader, how does the broader diet affect the school meals, or the other way around? If it's the second, yes, we are, I think I mentioned in one of the slides, we are trying to measure the impact on diet quality of school meals, but always measuring the whole diet. So we are trying to see, for instance, in I can say in Cambodia, in the study that we're conducting, we're trying to see the differences in total diet, in consumption of key food groups that determine dietary diversity or diet quality. From the changes to the school meal, but to see the overall effect on the diet, not only the nutrition quality of that meal, but rather on the total diet. This is what we are trying to see. And there are a few other studies that are doing the same. I can share them with you. And definitely, if we talk about impact, we need to see the overall daily diet and not only the composition of the meal. Um, Okay, well, considering the context.
Do you want to read it out loud?
Yeah. Okay, well, considering the context, it would be important to know that this is limited to government-funded schools only or private schools also. Okay, yes, the methodology, because we were supporting governments in FAO, it's mostly targeted to government run programs, but definitely the ones that are run private schools can get the same can get insight from the guidance, because the same steps apply also to private funded schools, and definitely sometimes the budget is not that much of an issue, but you can definitely take on the main phases or the guidance for applying it to a, let's say, subnational level or for private schools.
Great questions. Any other burning questions or clarifications right now? Oops. Okay. No. Okay. I will carry on if there's nothing else immediate. Okay, great. So I hope you are still all with us, just rearranging here a little bit. So we now are going to continue on. I think Melissa, both Payman and Melissa did an excellent job of setting up this presentation, which, as Melissa highlighted, is really to share with you all a new and innovative metric, which is listed here, the Global Diet Quality Score, which I'll be referring to as the GDQS meal and menu metric, and also an app that is designed for data collection. I'll be focusing primarily on the nutritional quality aspects of these metrics, but work is underway to incorporate environmental impacts. So I'll be kind of giving you a peek under the hood at those, and then look forward to hearing your feedback and thoughts on that area of work. So, just in terms of context, and I think both Melissa and Payman made this very clear, school meals fit into the overall diet of the children and of the population, right? So it's one, or in some cases 2 meals a day that children are having at school. Of course, the overall diet quality is ultimately of greatest importance to us. And I think as Melissa really highlighted and indicated, and I see a couple of people in the room who I know through work on dietary assessment as well, there's a lot of, historically, there have been a lot of data gaps and questions just around the overall kind of diet quality and nutritional quality in populations globally. So, as per Melissa's presentation, that information on diet quality itself is a really important data point when we start thinking about designing standards and guidelines for school programs that do provide the correct nutritional composition to students, right? But as we, in this presentation, we're really zooming in to be thinking about specifically the meals that are provided to children. And the metrics I'm going to be sharing are not designed to necessarily measure nutrition or diets at the individual level, but rather to be measuring and assessing the quality of the meal that's provided at the institutional level, right? So for those of you who have a background in nutrition, you're used to thinking about the individual as a unit of measurement, but here it's really more the institution. The other thing that I want to say before I get into the presentation is just with regards to Melissa's presentation, these metrics become critical at 3 of the 7 phases that Melissa presented. And I know there was a lot of information in there, so just to kind of remind you, there was, phase 2, which relates to basically a situational analysis or assessment. These metrics could be relevant at that stage. They again become relevant if you as a government or as a country have established nutrition guidelines and standards and you want to test the meal that is being proposed, the composition of that. And then again, of course, step 7, the monitoring and evaluation phase, which Payman also highlighted as a kind of critical entry point for these metrics. So I might have just answered my own question here, but I'm going to shift screens. So specifically in a more, I guess, general sense, would like to hear, I'm having a little bit of an issue with Zoom now. Your thoughts on this question. So from your perspective, based on everything you've heard so far, why do you think it might be important to measure the nutritional quality of school meal programs?
Oops.
Okay, Melissa's next to me and also responding. So this is also just a check to see, who's with us still, even though we don't have any names or information. So great, great. Excellent. So maybe some of you aren't responding because it seems, I don't know, quite obvious. But basically, if you choose any one of the above responses, as well as option E, all of the above, you are on to something because measuring the nutritional quality of school meal programs is essential for multiple reasons. As we've highlighted already, of course, the monitoring and evaluation component is really critical, and that's what provides us insight and feedback to understand where improvements may need to be made and where there might be positive deviants in the school system who are performing particularly well. But we can also use these metrics to help us determine the nutritional quality of a planned menu or measuring the impact of an intervention with a pre and post type indicator, as well as overall advocating for change and further investment. And that can happen at both the global level, regional, or national levels. So all of the above is a correct answer, but if you chose any of the other ones, it would also be completely correct. Great. So just to go back now, I think one second, I'm having some sort of weird issue. Just bear with me. Okay. Thank you. Okay, so these metrics, which I will be explaining in greater detail momentarily, are here we go, many boxes open, are designed to fill some of the major gaps that Payman and especially Melissa really highlighted, right? At the end of Melissa's presentation, she was highlighting the fact that until recently, not only has there been a lack of data on the nutritional quality of school meals, but also there has been a lack of tools and metrics to allow us to collect data in a globally comparable way. It was really with this gap in the measurement landscape that Rockefeller, about 4 or 5 years ago now, had determined that this was an important area for further investment to design metrics and an app that would allow for easy collection and use for evaluating the nutritional quality of meal and menus in school meal programs, both at the preparation, planning, and serving stages. The metrics themselves are designed to be globally comparable. This doesn't mean that you need to use them across countries, but if you choose to, you can. They're also designed to be, they have been rigorously developed and tested. They're actually a modification of the original Global Diet Quality Score, which you might be familiar with, the GDQS, which is designed for measuring 24-hour recall with an actual respondent, right? And so that's, if you are familiar with the GDQS, please put that on the side because that is a different metric. But that was developed by Harvard and Intake and the National Institute of Public Health in Mexico. So these metrics, again, are designed to measure nutritional quality at the institutional level. As part of these metrics, we have validated benchmarks for identifying low, medium, and high nutritional quality meals and menus. We've also developed the app, which allows for efficient data collection and real-time results. And then importantly, the metrics, as well as the app, are designed to be easily integrated into existing national programs for ongoing surveillance, for monitoring and evaluation, and for a series of other considerations. So, I think this has already been highlighted a little bit, but these metrics can be used in a variety of instances. As Melissa highlighted, we can think about measuring the nutritional quality at the planning phase, which is already a significant and important entry point. But we know there might be a big difference between what's been planned and what's actually served at the school level. There might be either resource or capacity constraints that don't allow us necessarily to measure the typical meal as it's served. So we might consider measuring the meal as it's been prepared, or we could consider multiple entry points for measurement. Of course, there's always a trade-off between time and resources. So at this point, it's sort of a case-by-case basis in terms of when and how is the best use case for these metrics. But just to highlight that they can be used at the planning, preparation, or service stage, or as a program fidelity measure anywhere along that, comparing multiple points along that pathway. So these metrics, there are a couple of things that are really important for you to know, I think, as we get into them further and before we get into the demo, which are that they're designed to be 100% food-based. This means that we eliminate the need for a food composition table or other detailed data to be included. The GDQS meal metric is designed to measure a single meal. This could be a breakfast, a lunch, or a dinner, or I suppose a brunch if schools are serving that these days. But the point here is that we should always be comparing apples with apples. So if across a school meal program, you're measuring lunch, a school serves breakfast and lunch, we should be comparing with a GDQS meal lunches to other lunches that are being served or breakfast to other breakfasts. We then have the menu score, which is designed to provide a summary score of the menu based on a week of the underlying GDQS meal data. In this case, a week is defined by the user, but can be between 2 to 7 days of meal data, and should again be comparing apples with apples. So if you're looking at lunches that are served in a school meal program, that should be maintained also for coherence within the GDQS menu score. I'm going to provide a couple more details. First about the GDQS meal metric, and then we'll get into GDQS menu. So the GDQS meal metric is basically collects its points through 4 different pillars. The first one is consideration of the different food groups. I'll be talking about these in more detail, but there are 25 food groups which are categorized into either being healthy, unhealthy, or unhealthy when provided in excess. There are different points that are associated with each of the underlying food groups based on the quantity of each food item that is provided. So these quantities can range basically from low, medium, high, or in a few select cases to very high. Points will also be awarded when there are fortificants and biofortificants included in the meal. We consider 16 different fortificants and 3 different biofortificants for this. So this is based on information that the user has on hand and can enter into the program. And then finally, we provide additional points for the overall diversity of healthy food groups that are provided in a given meal. So I mentioned that there are 25 food groups. These are organized into 3 different categories. So the vast majority are considered healthy food groups. We have 7 that are considered unhealthy, in quotation marks, unhealthy food groups, and then 2 that are unhealthy only when provided in excess or when provided in very small quantities. In the middle range, we consider them to be healthy, and actually for the student age groups that we're looking at here, of quite significant importance. To provide a little bit more information about the scoring, again, I want to highlight that there's a lot of detailed and rigorous research that has gone into the underlying, let's say, scoring algorithm here, and I can point you towards some of that literature. For now, though, just for the sake of illustration, I have here the diagram that sort of highlights how the scoring works. So what's important to take away is that we have the 16 food groups that are considered healthy. I'm only showing 6 of them here, but there are 10 additional categories, wherein the more that is provided of those food groups, the higher points are provided, right? Whereas for the unhealthy food groups, we see that the more of those food groups that are provided, the fewer points are provided. So at low levels of provision, the overall score fares better, right? And then we have these 2 food groups in the middle that, again, where the score varies from at very low quantities and at very high quantities, it works against the overall total score. It works negatively. Just also to highlight here that we have 4 submetrics. So you'll see in the app that we provide an overall score for each meal, but this score can be further unpacked to observe the 4 underlying submetrics that compose the score. This can be really helpful from again, a monitoring and evaluation and a program implementation perspective to understand what components of the meal or the menu might be potentially improved to further benefit the overall outcome. So we have the healthy, what we refer to as the healthy GDQS meal submetric, the unhealthy GDQS meal submetric, where points come from their respective food groups. We have a submetric focused on fortification and biofortification, and then a submetric focused on food group diversity. These submetrics also have with them what we refer to as benchmarks that are designed to help us evaluate the nutritional quality of the meals. Excuse me, not just the submetrics, the overall, the GDQS meal and menu metrics have these nutritional quality benchmarks. So they were, basically evaluated based on analyzing a series of menus from low, middle, and high income countries. We looked at the nutrient content of all food items across all meals for the nutrients of interest that you see here on the screen, and then conducted an analysis to compare and look at the nutrient ratios of the GDQS meal scores with the nutrient composition. So this ultimately allowed us to define these high, medium, and low nutritional quality benchmarks. We're working on a publication that is forthcoming that will kind of provide more details on this process if you're interested. Further, more, we have this sort of similar detailed option here with the submetrics where you can dig in further to look at the kind of optimal or suboptimal scores for each of the submetrics. I'm not going to be focusing too much on this today, but have it here for reference and for further information moving forward. So just to provide a little bit more detail on how we can think of constructing a meal and the associated score. I'm going to do this for the GDQS meal metric and then for the GDQS menu metric, and then we'll take us into the demo of the app. So here we're just going to have the most simple use case basically of thinking about the GDQS meal metric for just one meal where just simply white rice and beans are served, right? This is a case where we can see points are awarded for the presence of legumes. Points are taken away for the presence of the white rice, or points aren't given for the presence of the white rice. And then because of the presence of the black beans, we get some additional points for the healthy food group. presence. And this becomes particularly important when we get into the menu metric. However, this meal, we can call it, registered as being of low nutritional quality overall. Then we can think about making a slight change here, right? Where if we change the meal itself to having brown rice instead of white rice, so now we're serving brown rice and beans, we see an increase in the overall score, and again, a slight shift in the overall nutritional quality of the meal. We can further complexify this meal by adding fortificants to the brown rice. And so in this case, there are several fortificants that have been added. I think I had specified, I'm not going to try to remember exactly right now what I specified, but we can look at it later when we get into the data. So we can see here again that the score has increased, but it is still within the medium nutritional quality category. And then finally, we can think about the addition, for example, of a leafy green vegetable, in this case, spinach, which further increases the overall score as well as the overall food group diversity, with adding the spinach to the rice and, to the fortified brown rice and to the beans. So hopefully that gives you, just at a very basic level, a sense of how the GDQS meal metric operates. When it comes to the GDQS menu metric, as I said initially, the menu metric is designed to provide a summary score of the menu across a week, over a week of time. The menu metric is similar in many ways to the meal metric in that we have the same 4 submetrics that you'll see. However, it goes beyond just taking a simple average of the underlying meal scores. So in this case, we consider the unique addition of each healthy food group to be positive. So we provide kind of additive, unique points for those additional healthy food groups. And similarly, with the addition of unique fortificants and biofortified foods. So if a school meal program, let's say, is, fortifying milk every day with vitamin A, that would still just count as 1 point across the week. But if they have vitamin A plus an additional combination of nutrients on other days, then that would be a kind of additive example. So this is really designed to capture a bit more the meal quality and overall menu composition over time. So in terms of just thinking about this at the menu level, we can think about, again, going back to the very basic meal that we had of white rice and beans. We have this registering as being of low nutritional quality, whereas we can then add here on a Tuesday. So we have a Monday meal, we have a Tuesday meal of fortified brown rice and black beans. So again, this is similar to what we saw before. And then I'm just now adding a combination of foods here on Wednesday where we can see the score increasing, with maybe not as much as we would expect because the maize starch is considered a refined grain here, so points are lost. And again, the quantity of each food, this is something I'm not showing you here, but the quantity of each food provided also plays a role in the overall scoring. When we get to Thursday, we see a meal that is of high nutritional quality. And then finally on Friday, a meal that's of medium nutritional quality. And what I want to draw your attention to, though, is the overall GDQS menu score, which again isn't, it doesn't take the simple average, but rather takes a sort of modified scoring approach where we use the unique addition of each healthy food group and of each additional fortificant and biofortificant and sum that up. And I'm not able to see the bottom of my screen where there are some additional, okay, it's too bad. So hopefully when you see the slide deck, you'll see at the very margin of this slide, there's some additional information that might be helpful for you. So finally, and just
Whitney,
as a quick...
I'm sorry to interrupt, but you do have
Oh,
a
yes.
question in the chat before you move on.
Would chips, French fries count as doubly unhealthy, deep fried food plus white root?
Great question. So in the GDQS, the 24-hour recall GDQS, this is something we've discussed quite a bit and debated actually over time. So your question is spot on. In the case of the GDQS, we would count it like a double ding, basically. It would count poorly twice because, like you said, it's the deep fried and also the white root and tuber. In the case of this metric, sorry, the other thing I should say there is with the GDQS, it's for purchased deep fried foods. And that's because the GDQS determined that purchased deep fried foods were nutritionally different from a health and nutrition perspective than those prepared at home. For the purposes of this metric, we came to agreement that the something like fried potatoes, we would only be taking the points for the white root and tuber and not also for the deep fried. And that's because we see this not as a purchased meal necessarily. It's provided by the school. Of course, there may be cases where the meal is purchased, and this could be something that we could discuss further. Thank you for that question. So this was just quickly to highlight that, and this may make sense or may not make sense, but when we think back to the conversation, the comments by both Payman and Melissa earlier in terms of the importance of monitoring and evaluation, I just want to highlight, for thinking about, okay, I just showed you data for one meal that hypothetically could have come from one school. But when we think over time, what does this information actually mean? We're able to then get a clearer picture of how schools are actually performing in terms of the nutritional quality of the meals that are being provided, right? So this is just a sort of a figure to foreshadow the fact that, once you collect those data at the meal level, you can then look across a school system and understand where schools are performing very well or where there might be opportunities for further improvement. Finally, I'm going to belabor this. Finally, I just wanted to highlight the work that we have ongoing right now is to bring in aspects of environmental impacts into this work. So until now, the GDQS meal and menu metrics have been focused solely on the nutritional quality. But in this current iteration of our work, we're bringing in the 7 dimensions of environmental impacts that you see here, as well as developing a composite score that will assess the overall nutritional quality alongside the environmental impacts of given meals and menus. This, again, is just a kind of hypothetical example to show you the direction we're going in terms of being able to provide users with. This is one way we could visualize the data, sort of environmental footprint of various meals and menus over time. Okay. So for the sake of time, I am going to move on and ask you a question. I know I didn't say very much about the environmental impact work right now, but just kind of would like to get your temperature on how important you think that is. We've made a case for why measuring the nutritional quality of school meals is very important. But what do you think about measuring the environmental impacts of school meal programs in addition to the nutritional quality? Again, keeping in mind governments are resource constrained. Already focusing on nutritional quality is a very new area for many people. Nutritional quality of school meals is a new area. So what do you think about adding a whole other layer to this work? Okay, happy to see some of you responding. So far, it looks like not a big majority, but a number of people agree that it's either important or very important. I guess it is a significant majority, actually. Okay, unsure. That's a valid response. I think maybe more information is needed. Okay, great. Well, I think it's nice to see that a number of folks think that it's important or very important, and this is something that we could also discuss more in the open discussion towards the end, just to hear your thoughts on, how this could come into play. I should say that we expect to release the work on environmental impacts and have it fully integrated into the app, hopefully in the first to middle of 2027. So that will be available in the not too distant future, given how fast time moves. So great. stay tuned for that. Okay. So without further ado, I want to talk a little more just to provide a bit more orientation to the app, and then I'm going to take us in and do the demo that I've been mentioning. So firstly, I want to note that we have two tools right now. One is an Excel tabulation tool and an app that's designed to work both online and offline. I'm going to be showing you the app today, but happy to always set up a time. If for some reason you prefer Excel, I'm happy to set up a time to provide detailed instructions on how to use that tool. So again, as I mentioned at the beginning of my presentation, and also as Melissa highlighted, there are many entry points for using the GDQS meal and menu metrics, right? So this can be at the planning stage when you're, after you've used the nutrition guidelines and standards, for example, to set the meal and menu standards for the country. You could measure the planned meals and menus at that stage. You can also use these metrics to measure the overall procured bulk ingredients, for example, knowing that you might have an underestimate if you're missing some details of fresh foods. You can also use the metrics at the preparation level, at the service level, or as a program fidelity measure across those different phases. What is the information that you need to input to tabulate the GDQS meal and menu metrics? So you need detailed information on the food item that's being provided or that's being planned to be provided. You can break recipes down into their individual ingredient level information. You need either the gram or kg quantity for each food item. If it's the gram quantity, you have to make a decision when you're in the app as to whether you're entering information for the total student population or for the quantity as it's served or as it's planned to be served. In that case, you could use the gram quantity. If you're entering the kg amount, then knowing the total number of students that are in attendance becomes quite important because that becomes the denominator for the calculation. We also need information on presence of whether there are any fortificants or biofortificants when applicable and when available, and then the number of students that are enrolled or attending. As I just mentioned, this is particularly important when recording the total amount prepared. And then finally, you have to specify the age group of students. So whether between 24 and 59 months, 5 to 9 years, or over 10 years and above. Another thing just to note is that this system has really been designed to be flexible and easily able to be integrated into existing data collection and surveillance systems. As I mentioned, we have the GDQS meal and menu Excel tabulation tool, which I won't be showing you today, but worth noting that in that tool, as in the app, we have a food list of over 6,500 food items, which we have found so far to be generally globally relevant. These food items are categorized into the 25 food groups that I mentioned. And the Excel sheet tabulates the meal and menu scores with a push of a button. What I'll be showing you today instead is the GDQS meal and menu web app. This web app has to work fully online. However, the tablet and mobile app versions of the GDQS meal and menu app work fully offline and are designed for remote data collection. The other things that I'll just note is that the web app specifically is designed to be fully integrate to be able to easily seamlessly integrate the Excel tabulation tool. So if you do enter data into the Excel tool, you can just upload it through the web app and then output the results there. You can also, we have a data output file that comes out of the web app after you've entered the information. So if you want to do further analysis, for example, at the nutrient level to look at the nutrient composition of each meal, that's something that you could do further as a subsequent step. Finally, there's 3 different levels within the GDQS meal and menu app. I'm going to be showing you the data collector level today, and then the manager level to give you a sense of the interface for both of those types of users. And happy to spend more time of that on those in the future as well, if questions come up. So I'm going to just get into the demo now. And okay, sorry, I have Zoom popping up everywhere. Okay, so for the demo, as I said, I'm going to first start with what the view looks like for the data collector. So if we come here, just need to see one thing. It sometimes takes a moment to load. So in this case, as a data collector, let's just imagine this scenario where the person leading the school meal program in the government has established an account and has basically created a data collector account for 10 people who are in the country and moving around to collect data from different schools. I am then one of those data collectors in this case, and my first job is to set up the new data point. So let's say that I've been instructed to go to, I don't know, we'll say here school number 1, and then I have to select the program. So as part of the context, I decided to go with Curaçao, in part because if you're watching the World Cup, you might be excited like me that they are making positive progress, it seems. So anyway, we're thinking about a school meal nutritional quality program in Curaçao, and I am a data collector there. And this is in the capital, I believe, of Willemstad. And then we'll say that this is today for the sake of simplicity. Here, I also need to select the age group. So if the school spans multiple age groups, that's fine. There are a couple scenarios, like the school spans multiple age groups, but they're all provided the same amount of food. In that case, you should basically go through this twice, and it's quite easy. There's a way to just copy the information and change the age group. But for the sake of simplicity, let's just say the majority of students fall between 5 to 9 years old, and that there are 1,000 students enrolled. I'm going to say that I'm entering information at the per student level. So in this sense, I will be measuring, I'm going to move this, measuring the food as it's been served. Okay, so now I have the data point information set up, and it's time to enter the meal data. You'll see that this is designed to be quite straightforward. I'm going to stick with it being today. And this is for meal number 1. So this is just simply an effort of adding each food item that has been served on that day. So I will say that we provided them with, I don't know, a chicken leg for 150 grams, and that this included bone in it. So it had the inedible part there. And then you just need to save this. And I will say there is, let's say that they are serving brown rice, which is great, but not fortified. So I will not, or maybe for this example, I will share the fortified. So you can see here, we are able to just select easily the fortificants that are provided. So we'll say it's been fortified with folate and thiamine, for example. And then you can just save that. And then here we can provide, again, let's go with black bean. Well, just to give you a sense again of the food list, we can see here many different bean options with varying levels of detail. So I am going to just go with beans not eaten with pod and say 75 grams and then save. And I'll just add one more for this example. How about pumpkin? Pumpkin vegetable. Okay, 50 grams of that and save it. So I have now effectively entered one meal that I have observed as being provided, for example, or if, the cooks could have been trained. There are different scenarios, and we can talk about this in more detail, but either the people preparing the food can be trained to enter this information. A data collector can be the one traveling to the school to enter the information. So I've gone ahead and I've entered one meal. I have the option of selecting here to enter a new meal, or I can already come over and see on the analytics tab how that meal scored. So I see here right now we have a meal score of 34. It corresponds to the menu score because we only have one so far, so there's no change between there. And then down here we see the meal score with the breakdown of the different submetrics. Just for sake of example, I'll add one more meal before we switch views. So let's say this was last Friday now. I guess the chronology is not going to make sense, but okay, I'm going to do it for tomorrow already. Let's say there is fish. After all, Curaçao is an island. So I'll just go with a generic fish that we don't know the details on. And I'll say there were inedible parts also. And then spinach, I suppose. So you can see again, many types. And I know this might not be very exciting, but hopefully it might get more exciting in a minute when I show you the full picture. Oops, sorry, I didn't want to do green banana. Banana, and then yellow banana, and then say 100. And I'm going to say there was inedible part because I weighed it with the peel on and then save it. Okay, so here we have two meals in school number 1, and we can already see both of the scores, right? As a data collector, this is basically that level of access of information that I have. I do have the opportunity here to download the data point, which outputs an Excel sheet with all of the details that I've just entered for further analysis. But now as the data manager, let's say, or the person who is managing this work, I'm going to log in again now with the other view, just to show you here. So what you'll see first is a dashboard of all of the different school meal programs that, that I've done the data collection for as a manager. So this combines a lot of different data, which is why you have information here for 13 programs. Of course, today we're only interested in Curaçao. So we can just, for the purposes of right now, ignore these other examples and focus on this one. And so when we open that, we see here we have school 1, which is what was just entered. And then we also have this school 2, which again, in this hypothetical example, we can imagine that another data collector entered that information on school 2. So as the data manager, I can come here and I can see the 2 meals that we just entered, right? Just as a data collector, we have those reflected here. And then when I come back to the data points tab, I can come and look at school 2, which another, as I said, another data collector entered this information. And we can see here the detailed information for each of the meals. These meals happen to be the same ones that I presented in the slide deck, showing you sort of a variety of different low scoring to high scoring combination of foods and meals. We have the overall menu score. And then we have, again, the breakdown of each indicator. And, again, on the dashboard, we have more detailed information about the overall view, zooming into each of the food groups and the type of information that has been gathered. So I think for this aspect, I'm going to just stop here also because I'm cognizant of the time and that we have been doing a lot of talking. So just by way of wrapping up, I have a final question for you here. And then, it's please be honest. And then we will open up the floor. So the question I have for you is whether, based on the high-level overview that you've had today, how likely you would be, or the likelihood of you recommending the GDQS meal and menu metrics and app to colleagues or within your own work. And this is really helpful feedback for us as well. And then again, we can kind of talk about it. Okay, great. This is also helpful for me to know who's with us. Okay, so looks like based on what you've seen so far today? Yeah. Okay, I see there's a question, so I'm going to come back and answer it in the discussion. So when we open up that part. But I see people still inputting responses. So great to see, possibly, definitely need more information first. So for all of you who are interested in learning more or playing around with the app for your own, within your own research or just within your own life, feel free to go ahead and scan this QR code. In it, I'll ask, it's just a form with your name and your email address. It would be great if you can fill it out. I'll follow up within the next week, hopefully, within the next few days, really, with more details for how you can access the app, as well as some further background literature and reading for your information. I'll just leave this here for a minute while I keep talking. I do also want to note that if you've already checked, you'll see in the Google Play Store for Android devices, the GDQS Meal and Menu app shows up. You aren't able to download it until I set a manager account for you. So anyway, if you are interested in downloading that version of the app, please scan this and I will create a manager account for everybody who does so and then follow up with more details. Great. So I'm just looking in the chat now. Okay, great questions. Yeah, it's just taking me a moment. So on the first question, so I'm responding to the chat or the question from Deksha in the chat asking about the criteria for choosing nutrients, why some were included, others excluded. Very important question. So this actually maps back to the original development of the GDQS metric itself, the 24-hour recall metric. And I think to give you the most grounded response, it'll be best to point you to the validation literature on that. But part of it in the case of sodium is that that's very hard to measure in dietary assessment. And as I said, the original GDQS was developed for recall style, 24-hour recall style responses. So that's important to note. The second part of your question, can this be integrated within large surveys, for example, large multiple school intervention trial? I would say yes, absolutely. That's one of the kind of, primary use cases, I would say, in terms of being integrated into that type of setup. It has been used at this stage in a number of different cases, including, I won't say necessarily large survey, but in a impact evaluation pilot study in Burundi by the World Food Program, where this was integrated and used to assess pre and post impacts. And then for your point on applicability in workplaces or other institutional meals, 100%. So this, while the focus today has been primarily on school meals, also because it's a really important area and there's a lot of energy focused on it right now. When we developed these metrics, it was really seen as an opportunity and a way to use them as well in hospitals or in workplace cafeterias potentially. So you're definitely right about that. Thank you. And then I'm just seeing this message from Ahmad Bayu from Indonesia. Hello. Okay, so I think this might be a question that we can answer. It looks like it's for both of us. Yeah, so maybe during the discussion, we can come back and answer this question. But we're about to go there, so it's perfect timing. And hopefully anybody who wanted to scan the QR code has now done so. And please, and yes, you're welcome, Deksha, and definitely happy to have further follow-up and discussion on your points. Okay, so actually we're here at questions. And then we were going to move on to group discussion. So I think because of the time, I can't believe it, we only have not very long left. Maybe we'll move into the discussion and respond to this question first. Do you want to? Yeah. Okay, so we have a question in the chat, and while others are thinking of questions, we're going to then move into this broader discussion. But the question from Bayu is wondering, motivation. Okay, so, okay. So I think, first I can say from a GDQS meal and menu perspective that there's, the first part is, I guess, depending on what the use case or the intervention objective is. So this would be a bit of a question back to you, Ahmad Bayu, in terms of what area you're particularly interested in focusing on when you think about executing the operational menu and nutrition requirements. I think that, as you've seen hopefully from the presentation, the GDQS meal and menu metrics are really designed to be flexible and to be able to be integrated into multiple use cases along the data quality chain. So I think, if you're interested in discussing more, I would be happy to set up a call to talk about exactly how that could work in your specific instance. I don't know, Melissa, if you want to add anything based on.
Yeah, I think that if I'm interpreting correctly, you are talking about the development of menus based on nutrient requirements, and this is all included step by step in the methodology that I presented that would be available in the upcoming weeks. And we show the process of how to make decisions in terms of nutrient targets based on the children's nutrition requirements, as well as on food group targets based on dietary gaps. I will leave you with the a link where this guidance will be published here in the chat, and definitely also would leave with my contact as well as Winnie's contact, so you can ask more specific questions on that. Thank you.
Absolutely. Great. Thank you. Okay, so we have just a couple of minutes left. For anybody who would like to share, originally we had envisioned having a Miro board with more opportunities for people to type in and share, but we had some technical challenges. So instead, we've decided to go with the low-tech option of just open discussion. So if you would be so courageous, if you wish, to unmute yourself and share any reflections or insights from the Learning Lab today and how it might be useful in your own work, or if it's raised questions for you that you want to explore further, we would really appreciate your feedback. And then we'll do a quick wrap up.
Or also in the chat.
Yeah, or feel free to enter in the chat if you don't want to unmute yourself.
Maybe we leave a couple of minutes so people can come out. Oh, okay.
Great question. I don't know, Payman, are you still on the line? And you might also want to weigh in on this one.
Yeah, I'm here.
Great.
So, yeah, go ahead, Winnie, and then I can chime in as needed.
Okay, perfect. Yeah, I was just going to say thanks for the question, Javier. And so right now, the GDQS Meal and Menu app is not designed to also include the affordability piece. It is something we have discussed, but right now that is not in there. Yeah, so that also applies to your second question. But I think it's a really great point, and I know, of course, of the cost is a very important consideration. Payman, do you want to say a little bit more about all that?
Yeah, no, just to mention that, let's say demoed here, Winnie has demoed the app, the different tools that have been developed. But I think equally important is that these metrics can actually be embedded or programmed into existing tools, into other existing tools. So, for example, the S&P Plus tool of WFP, Optimum, etc. So this is one option to deploy the tools, right? So and they're also sort of a proof of concept that this can be turned into very easy to use tools that can be used from program designers all the way to data collectors. But the same metrics can be embedded in other applications, and some of these applications actually do track cost of food items and ingredients. So at that point, you would have both combined. Thanks.
Great. Thank you very much, Payman. And yeah, thank you for the feedback also, the positive feedback. Any other comments or observations? Thank you, Victoria, for that feedback. That's great to hear that it's been helpful, and look forward to being in touch with you, definitely, if, as questions come up.
And then, Winnie, if I may, on Javier's comment, I think also when a country is deciding on their national nutrition guidelines and standards for school meals, we also recommend undertaking an assessment of a price and cost of the supply of potential ingredients for the school meal to make decisions on what can the program provide, and we go back to the feasibility as well. So not only at the level of designing the actual recipes, but from the beginning on the setting the standards that the program should comply with, and then try to understand what are the different costs or the aspects on if there are commodities or there are ingredients that are suffering from a price instability, how to ensure to have a good substitutes in terms of nutritional quality. So from the design also comes that consideration in terms of cost.
Very true. Yeah, great points. Good. So just appreciate everyone who's inputted information. Thank you, Lorna, Lynette, for highlighting, the many applications for the measuring nutritional quality, not just in schools, but also hospitals or care facilities. And yeah, there are a lot of potential applications here. So that's great. And do you want to say something? No. Okay, I'm just going to say, Aisha, thank you also for sharing, really for both the positive feedback and also for sharing about the context in Pakistan. So yeah, understand that right now there are restrictions in place for certain foods, but it's kind of at the beginning stage. So I think you're in good company there, and that's where many countries.
Yes, and we are promoting also the coherence between what is sold in schools and what is provided by the school meal programs that many times are not in coherence. There really are issues with the policies and the nutrition guidance and standards for both.
Yeah, I see a question that just came in from Lorna Lynette Chikoto about whether the GDQS meal and menu app, metric and app, was designed to take account of schools that use commercially made ingredients, for example, prepackaged fries, or I imagine chips or biscuits. And the answer is yes. So in that food list, when you start testing the app yourself, you'll see that in the food list there's many food items, not brand specific, but it would include things like prepackaged fries or biscuits for you to select. So I'm cognizant of the time, and I just want to do a quick kind of closing and wrap up with some key takeaways. And again, we really appreciate the feedback and thoughtful comments and questions. So thank you all very much. So I have this takeaway slide, but Payman, I wonder if you want to do the honors or make any, not to put you on the spot, make any closing remarks, or I can do the takeaways and then hand it
No,
to you.
just a very broad comment. Thanks, Winnie. That food is extremely complex. We have to start by acknowledging that, right? And I think even the pull down menus on the app highlight that. So food is extremely complex. Measuring it in different contexts is very complex. So these metrics and the associated tools really try to strike a balance between, let's say, capturing that complexity and to a large extent, sort of hiding it under the hood so that it can become a practical tool that from, as I said, program managers all the way to enumerators, it can be used in practice and can generate valuable insights to improve school meals, menus, and programs. Thanks.
Great. Thank you, Payman. So I am about to switch into some very quick high-level takeaways from today's session, but I see that Bayu, you've raised your hand. Did you want to make a final remark? And it might be an accidental, I don't know. Okay, I'll carry on, but if you do want to say something, just please let me know. So just by way of wrap up, if you took nothing else from this last 2 hours, a couple of high-level takeaway points. Firstly, that school meal programs represent significant investment opportunity with high returns for human capital. However, to realize these returns, we need to think carefully about the quality of the nutritional quality of the meals and menu programs that are put into place, starting with the standard and guidelines, right? So until recently, we know that the focus has primarily been on the coverage of school meals without so much emphasis on the nutritional quality. And this has been a sort of long-standing evidence gap with a general lack of information on the nutritional quality of school meal programs, in part because of a lack of tools and metrics for measuring that. We heard today about the nutritional standards and guidelines and the important role that they play in setting a critical first step in ensuring that school meals meet the context-specific dietary gaps of children in those specific places. We also learned about the GDQS meal and menu metrics, which have been designed to fill this specific measurement gap related to measuring nutritional quality of school meals and allow for globally comparable results on the nutritional quality and eventually also environmental impacts of meals and menus. We also saw the GDQS meal and menu app, which again was designed to help efficiently collect data on meals and menus. So thank you all so much for your attention and again, thoughtful feedback and questions. We can put our contact information. I have a slide here with resources and my contact information, but we can put this into the chat so that you have it moving forward. And really.
Winnie,
Yes.
apologies. I think Bayu is able to speak now. Bayu, did you want to make any final remarks?
Yeah, ma'am, Sir Payman, Ma'am Weibel, and Madam Alfar. Nice to meet you. I apologize if I acronym your name. In Indonesia, like banyak nama, banyak rezeki, insyaAllah. My name is Ahmad Bayu Aryawan. I am alumna of Animal Science Program, faculty member in Haloale University in Southeast Sulawesi of Indonesia. My plan after learn about lab is about my plan by research in my second master's about I have many thing about fat chicken, fat poultry like chicken and duck for using as the emulsifier of ice cream in gelato from goat milk. So I will using it to recommend it as the recommended for meal school. And I think why I have the poultry fat, because poultry fat uh, dominantly much dominantly using for Indonesia, like empasi, makanan pengganti air susu ibu. And I think the using of fat, chicken poultry fat is the strategic for minimalize waste uh, housing waste of slaughtering poultry in Indonesia. So I hope I will implement about fat chicken to the research of it. I'm so sorry.
No, you don't need to be sorry. Thank you for taking the chance to raise your hand and for sharing your insights on your research. Please be in touch directly. And for everyone else here, thank you. Here's Melissa again. Thank you all again for your attention, and look forward to seeing what comes next in terms of the exciting work in this area.
Thank you.
Thank you all.
Bye-bye.
Take care.
Thanks, everyone.
Thank you.
Thank you, Main
Thanks
Wife.
so much,
Thank
Winnie,
you, Main
Melissa,
Sir
and
Payman.
Payman.
Thank
Bye-bye.
you.
Hey,
Bye.
Michelle. Thank you, Main
Bye.
Malfa. Salam
Thank
cinta dari
you.
ujung kandang.
Wonderful. Thank you, everyone, for joining.
Thank you again.